Welcome back and good morning, Central Oregon. Dr. Darren Kowalski joins me this morning from Ben Memorial Clinic. Good morning.
Good morning.
So we're talking this morning about colorectal cancer. How common is this cancer?
Well, it's actually a very common cancer, the second leading cause of cancer death in America. So there's about 140,000 cases diagnosed every year. About 50,000 people die of it every year. So it's a common cancer for sure.
Is there a kind of a typical patient that comes down with this form of cancer?
Well, certainly there's a family history in a lot of these patients. Up to 25% of them are going to have some sort of family history. But in terms of how they present, it's often abdominal pain. It's often changes in their bowel habits, blood in their stool, maybe weakness, those sorts of things.
Something's not right. And
yeah,
you can just feel it.
A lot of times, not always. And therefore, there's a lot of importance in just doing the screening, because you don't always have those symptoms, and you want to be able to get that before the symptoms happen, ideally.
We'll talk about the screenings in just a second, but do you see this mostly in older patients, more women than men? I mean, what are the statistics surrounding that?
Well, about 90% of these are going to happen in people that are 50 years or older. Okay. And so that's one of the bases for the screening recommendations that we'll talk about. But certainly age is probably one, like many cancers, one of the biggest risk factors. Not necessarily a predilection for men or women. There does tend to be a higher incidence in African Americans than whites.
And you mentioned about 25% have a family history
of
that. So screenings, you said 50 is kind of the magic number there?
Correct.
Okay, what if you have a family history? Do you talk with your doctor and maybe get in earlier sometimes?
Yeah, I think that's the key, is really, you know, talk with your doctor. Make sure that you're getting your physical exams and go over that stuff, because nothing's set in stone. And yes, if you do have a family member that's affected, particularly if they're diagnosed at a young age, then you want to make sure that you're getting in earlier than they were diagnosed. So the 50 is kind of that standard, and that's usually, general recommendations right now is colonoscopy at 50 every 10 years if your colonoscopy is completely normal. If there's polyps and those sorts of things, then we'll decrease the frequency of those exams. There's other options for screening as well, but that's kind of the generally accepted way that most people are doing it. Most gastroenterologists and surgeons are recommending. Okay.
How is this cancer treated?
Surgery first and foremost.
Okay.
So I'm a surgeon, and you have to cut it out, basically. And that's we want to remove it, not only cancer, but all the lymph nodes that drain that area of the body, because that's very important in the staging, which has implications on the treatment down the road. Chemotherapy, there's always advances coming out all the time, but really it's surgery first and foremost. And radiation therapy for colon cancer doesn't play as big of a role as it might for rectal cancer. It's just differences in how we do it.
I was reading that with this, it is so important, obviously, to catch any cancer early. But this one in particular will spread very rapidly through those lymph nodes.
It can, correct. And that's why we want to, when we're taking that out, we want to get those lymph nodes, as many as we can, because that has a lot of information for the oncologist as to whether they're going to recommend chemotherapy or not. And in general, if the lymph nodes are involved, then chemotherapy is recommended. If they're not, then it's just surgery and that's it. And so just because you're diagnosed with colon cancer doesn't mean that you have to go through chemotherapy and hair loss and all those things. If we get it early, you get your surgery, it's done, and you're done with your therapy.
Have there been any recent changes or advancements in the treatment of colorectal cancer?
Well, there have. Like everything in cancer, you know, we're seeing newer chemotherapeutic agents come out all the time, as recently as the last few years. A newer chemotherapeutic agent for advanced colon cancer. In my realm of medicine, it's really laparoscopic resection. So rather than the old-fashioned big incision to go in and take out that piece of the colon, it's smaller incisions, usually about 4 incisions, and we do it laparoscopically, so the biggest one is about that big, and it speeds recovery, it speeds the time back to work, less pain. You know, across the board, a lot of the advantages that we see with laparoscopy that we in other parts of the body, of course, we're seeing them with colon surgery too.
Sure. Is there anything we can do to prevent this cancer?
Well, I think the key is really staying on top of it and making sure that you're seeing your doc and you're talking about it and you're getting your screening. And I think as time moves forward, we're going to have different tests. We're already seeing tests in the stool to try to find out who's at risk, and there's going to be genetic testing. There are, certain genetic syndromes that are associated with this, and we're going to learn more and more about those. So the future holds a lot of brightness for trying to detect these things early, even on a genetic basis. But at this point in time, see your doctor, make sure you're up to speed on your screening.
Absolutely. If you have any questions about what Dr. Kowalski spoke about this morning, you can call him at Ben Memorial Clinic, 541-382-2811, and then benmemorialclinic.com. So it was great to see you this morning. Thank you.
Thank you very much.